My name is Dr. Eugene Yen. I'm a gastroenterologist from North Shore University Health System in Evanston, Illinois. I'm also the clinical assistant professor of medicine at the University of Chicago. And I primarily see a practice of Crohn's and colitis patients. IBD stands for inflammatory bowel disease. It's a chronic inflammatory disorder of the GI tract. It's quite common. About 1 in 200 people have inflammatory bowel disease, and that translates into about 1.4 million Americans. We're not entirely sure what causes IBD, but we think a host of genetic, environmental, and immune factors play a role. There are several genes that we're discovering that places someone at a more increased risk to getting inflammatory bowel disease. There's not a cure for IBD, but we've made great improvements over the last 20 years in a treatment of IBD. I think our expectations of our IBD patients have changed. We now expect our IBD patients to live normal, healthy lives.
My name is Mary Ayers. I'm a nurse at University of Chicago, and I specialize in inflammatory bowel disease. First of all, food does not cause IBD. Food does not cause inflammation. Sometimes food can make a patient's symptoms worse when they're having a flare. So it's important, if you as a patient, that you sort of keep a food log so you know what may be your triggers on food that would exacerbate symptoms when you're having a flare. Patients that are flaring, that have constant diarrhea, if dairy bothers you, stay away from dairy. If it doesn't bother you, then it's okay. So I try and tell my patients to sort of gauge what bothers you to stay away from. The food itself, again, will not cause inflammation.
My name is Jonathan. I have Crohn's disease, and I got diagnosed 4 years ago. When I was diagnosed, it started off, I had a lot of discomfort in my butt. I was very uncomfortable. I had troubles pooping, quite frankly, and it was a struggle, to put it in the most appropriate way.
The symptoms of ulcerative colitis and Crohn's disease differ among patients. Many people describe abdominal pain, cramping, bloating, diarrhea, bloody stool, although those symptoms depend on where the inflammation is in the bowel. Sometimes other symptoms can occur outside of the bowel. That includes joint pain and fatigue, weight loss.
My name's Sabrina. I was diagnosed with Crohn's disease when I was 19. I think being newly diagnosed with Crohn's disease or ulcerative colitis, or any disease for that matter, is a hard thing to deal with personally. So I think you have to be picky who you tell. Not everybody's going to understand, nor do you trust everybody. But I think it's important to let the people close to you understand. Going through something like that is an emotional experience as well. So you need a support system because you can't get through this stuff alone.
The advice I would give to someone newly diagnosed with IBD is attitude is everything. Always stay positive. If you don't, it's going to make you feel so much worse. And it's amazing how putting on a smile every day can just make all the difference. How having a good laugh can just kind of cure everything for you in terms of just how you're feeling emotionally as well as physically. It makes so much difference that it's hard to explain, but a smile really is so amazingly helpful.
I think my key message that often is that I want you to have a normal life, and I expect you to have a normal life, and that it means having a job, going to school, starting a family. But my other message is also that they need to communicate with me and communicate with their physicians about how they're feeling and their symptoms.
Education is probably the key to this disease. First of all, learning about the disease, knowing that this is chronic, this is lifelong disease for you, to be educated about what the signs and symptoms of flaring are, to be educated about medicines, what the medicines do, why it is important that you take them, why it's important that you take them when you're actually well, to keep yourself into a remission state.
It's important to educate yourself about IBD because if you don't know what you're doing, if you don't know what's wrong with you, you can't be proactive and take steps forward. Obviously with Crohn's, every type of Crohn's is different. So you can't just say, oh, well, this person did this and this person did that, so I'm going to do that too. It's trial and error. And you need to ask, you need to find out, and you need to learn.